Welcome to MD Longevity Lab, where we're playing the long game. This is a podcast where science meets real life with expert insights, practical tips, and real-world tools to not only live longer, but live better. Our aim is to radically change the way medicine is practiced and enable individuals to age gracefully, maintaining health span and vitality well into their later years. We're your hosts, Dr. Nisha and Dr. Vikas Patel, physicians, partners in life, and parents balancing work, wellness, and everything in between. Let's dive in. Hi, everyone. Thanks for joining us on the MD Longevity Lab podcast, where we are playing the long game. So, question for the audience. How many of you have been on the phone with your insurance company in the last 3 months? Not to pay a bill, not to sign up for insurance, but to actually try and use the insurance that you already have that you pay for every month.
Yeah. How long were you on hold? How many times were you transferred? How many AI agents did you talk to? How many times did someone named Brad with a headset tell you that MRIs need a prior authorization or you need to get an x-ray before that? And they don't even bother to explain why.
And then how'd you feel afterwards? Calm, cool, relaxed, healthier, reassured that the system has your back, or did you want to throw your phone into Lake Michigan?
Yeah. If that was your reaction, it was a correct one. The system is actually broken. We all know that. And I think we see it firsthand being physicians. You're not imagining it. And we're going to spend the next hour explaining how broken it is and what you can do about it.
So this is what we're going to cover. First, how the insurance business model actually works. It's not really what they sell you in the commercial with the happy golden retriever running around. Second, what are prior authorizations? Why do they exist? And why it's the single most profitable word in American healthcare.
Third, why doctors are leaving in droves, not for money, but because the insurance model is no longer sustainable. And fourth, we're going to cover the actual numbers, premiums, deductibles, profits, denial rates, all are worse than you think.
And lastly, who actually pays when insurance delays your care? Hint, look in the mirror. Sixth, what your insurance will never cover that could genuinely extend your life. And really, finally, what you can actually do about all this starting this month without waiting for Congress to fix a system that Congress has no intention of fixing.
Buckle up, guys.
Here's our thesis. The American health insurance industry is no longer in the business of paying for your health care. It is in the business of delaying your health care long enough that someone else has to pay for it, and that someone else is usually Medicare, which means it's you and me and all the rest of us with our taxes after you turn 65 and naturally get sicker.
Yeah. I'm sure you guys can hear the frustration in our voice. And if you can hear it, it's because we're very frustrated. Vikas and I you've spent the last 20 years in emergency medicine, watching people show up at 3 a.m. with problems that were 100% preventable. Myself in the primary care space, same thing. Just it's like watching a slow train wreck. And over the years, it's been denials, poor insurance coverage, just crappy care for most people.
And now we run longevity practice, so we kind of see the other end of it. People sit across from us and will say, I asked my insurance if they'd cover this whole body DEXA scan, and they basically laughed at me.
Yeah, they didn't literally laugh. They sent a letter saying it was not medically necessary, which is crazy because a whole body DEXA, which we all know by now, tracks visceral fat, lean muscle mass, your bone health. Every single person in this country had a baseline and could use that as a tool at the age of 30. We would be so much better off. But here we are.
That's right. Okay, so let's start with how the insurance business model actually works, because I don't think most people genuinely understand it. And the industry would very much like to keep it that way. Here's a version they sell you. You pay premiums, they pool the risk. When you get sick, they pay for your care, and everyone wins.
Yep. But here's how it actually works in 2026. You pay premiums, they turn around and invest that money. They find every possible way not to pay for your care. And the longer they delay that care, the more money they earn on the float, which is crazy.
Totally. Meanwhile, they are quietly hoping that by the time you're catastrophically sick, you've aged into Medicare, at which point, congratulations, you are now the federal government's problem and no longer a line item on their balance sheet. This isn't a conspiracy theory, it's the literal mechanics of the industry. So, if I write a prescription for a patient for a blood pressure medicine or a diabetes medicine, the insurance company knows 100% that they are going to pay for this medicine. But if they reject it the first time I send the prescription through and say that a prior authorization needs to be completed and or they say that this needs a peer review, they may delay the patient getting that medicine by a month. That is a month that they have your premiums that they did not have to pay out for you to get this medicine, and they have now delayed your care and use that premium money to invest, make a return, and not give you the care that you deserve, basically.
It's crazy. It's like the biggest racket of our century.
Totally, because they know they're going to end up paying. It's just every single day that they delay paying is a little extra money in their pocket.
For sure. And the numbers prove it. Let's just look at the 2025 scorecard for insurance companies because it's genuinely stunning. The seven largest for profit health insurance conglomerates, United Health, CVS Aetna, Cigna, Elevance Anthem, Humana, Centene, and Molina took in nearly 1.7 trillion in revenue last year and booked more than $54 billion in profit. That's crazy in profit. And here they are sending denials. Patients are literally running into a wall. Physicians are getting denied payments and even having to give back pay to insurance companies. It's such a racket.
Cigna alone posted 6 billion in profit. Elevance posted 5.7 billion. Fierce Healthcare, and this is widely characterized in the business press as a tough year for insurers, which tells you everything you need to know about their definition of tough.
Yep. Meanwhile, the people paying those premiums are getting squeezed harder every year. The average family premium for employer sponsored healthcare in 2025 hits $26,000, up $26,000 per year, right? Which is up 6% from the year before. That is roughly the price of a new Toyota Corolla hybrid car every single year. And it's just going up, it's not getting better.
Yeah, you're buying a Toyota Corolla in health insurance premiums. You just don't get to drive it.
Pretty much. And deductibles are up 17% over the past 5 years. We all know that a deductible is the number that you have to spend before you can actually even use your insurance. And that's aside from the monthly premiums we have to pay. So 72% of covered workers now face an out of pocket maximum of more than $3,000 for single coverage. And one in five people face a maximum of about $6,000. So the deal is literally insurance is telling us give us $26,000 a year, then give us another $6,000 a year out of pocket before we even start helping you. And they have the right to say no. So no one is holding them accountable.
Pretty much. And I think this is some of the mechanics of this that people miss. Like the insurance company makes money three different ways. They collect the premiums, they invest those premiums and earn returns while they hold your money, and they deny and delay enough claims that the ratio of dollars in to dollars out always stays favorable for them.
Yep. And like you mentioned, every claim they can push off, every appeal they can shut down, or even if they run the clock an extra month or two is pure profit. So there's no scenario where approving your MRI faster makes more money for them. The incentive structure points in exactly one direction, and it's not towards your good health.
Let's move on from that to the prior Hoff thing. So, how do you turn premiums into profit while not paying for care? And that is really what this prior authorization process is. This is the single greatest financial innovation in the history of American health insurance. It's also not coincidentally the most infuriating experience of being a doctor or a patient in 2026.
Yeah, why don't you walk everyone through what actually happens with the prior authorization?
Okay, so you go to see your doctor who went to medical school, did a residency, passed a bunch of board exams, and has been practicing for 20 years. And that doctor says, I think you need an MRI, or I think you need this medication, or we should do this procedure. In a sane universe, that would kind of be the end of the conversation.
But it's not.
It's not. Before the MRI can happen, your doctor has to submit a request to your insurance company asking for permission. Then a clerk who did not go to medical school, has never examined you, and in many cases isn't even a human anymore because it's AI, it's an algorithm, just doing a review process, decides whether the MRI your doctor recommended is actually medically necessary.
And most of the times they say no, but you can appeal, and that appeal takes weeks or months, or you can pay out of pocket. So that's thousands of dollars for an MRI, or most people just don't end up getting the MRI. They give up and hope whatever's wrong with them eventually goes away. But that's the model.
The numbers on this are like truly obscene. In 2024, Medicare Advantage insurers processed nearly 53 million prior authorization requests. 4.1 million were denied. And that's just Medicare Advantage, just seniors in one corner of the market.
Yeah, when I started in private practice, this was 16 years ago, there was no such thing as a prior authorization, right? We barely even had a copay. Just things were covered. We could do our jobs as physicians, we could see patients, prescribe them the medication they need, order the tests that they needed, and there wasn't pushback. Now insurance companies have created mountains of paperwork, denials, red flags, red lights to stop us from doing our job. So that's why a lot of physicians are leaving in droves because it's just completely unsustainable. We're basically met with a no every single time. But here's a part that should make every one of you furious. All of the denials that actually got appealed, more than 80% were overturned. 80%, which means the insurance company was wrong 4 out of 5 times.
If a doctor was wrong 4 out of 5 times, we'd lose our license. If an engineer was wrong 4 out of 5 times, bridges and buildings would collapse, right? When an insurance company is wrong 4 out of 5 times, that's just normal business. It's actually their business model.
Yeah, and it works because only about 12% of denials ever even get appealed. Appealing a claim takes time, energy, and first of all, knowing that you even have the option to appeal. So many patients don't even know that. So most patients give up. So the denial that the insurance company gives right off the bat, that works. And not because it was the right call, it's because the patient was exhausted.
And it's getting worse, right? So initial Medicare Advantage denial rates now average 15 to 17%, more than double the 8% rate in traditional Medicare. The AMA surveyed 1,000 practicing physicians on this, and the results are like honestly stomach turning.
Give it to us.
94% said prior authorization delayed patient care. 78% said patients abandoned their treatment because of it. And 24%, so 1 in 4 physicians, said prior authorizations had led to a severe adverse event for one of their patients.
Yeah. A serious adverse event is basically medical language for somebody got hurt, hospitalized, or killed. So the insurance company's model, they delayed the care and a patient paid the price. Nobody goes to jail for that. It's just business as usual for the insurance companies.
That's right. No one gets fined. In fact, somewhere in a skyscraper in Minneapolis or Hartford, Connecticut, someone honestly gets a bonus for that because the denial showed up on a spreadsheet as savings.
Let's move on to segment 4. Doctors are leaving, and it's not for the reasons that you think. And here's something that's happening right now that most people have not fully registered. Doctors are leaving primary care offices to go to concierge. They're not retiring. They're looking for other ways to basically make an income because being a doctor is a burnout job now. They're walking away from traditional insurance based medicine altogether.
In 2012, about 60% of physicians were in physician owned independent private practice. By 2024, that number was only 42%, a drop of 18 percentage points in 12 years. That is not like a gentle trend, that's a stampede of physicians leaving.
I started private practice, what was it, 2010. So I was in that 60% of physicians, and I can't even imagine now in 2026 what that percentage is. So few of us are in private practice right now because it's just unsustainable. And where do these physicians go? Most went to work for big hospital systems, which now employ or affiliate with at least 47% of all the doctors in the US, up from under 30% in 2012, right? So the majority of physicians in 2012 were in private practice, which means we could make informed decisions about our patients for you without a giant hospital system over our heads making those decisions. Others went to what Vikas affectionately calls the dark side.
Which is a couple things, right? Yeah, so the dark side, which is either directly working for insurance companies. I know that sounds absurd, but insurance companies now own doctors' practices at a pretty massive scale. Uh, and also, a lot of private groups have been bought out by private equity, and private equity has basically found ways to reduce payment to physicians, try and package these groups by making them bare bones and then selling them off to another private equity, and basically most of the time end up bankrupting the groups, and the physicians then leave and go to either work for insurance or big hospital groups. So how massive is this problem? United Health Group alone employs over 90,000 physicians. That's about 10% of every practicing doctor in the United States, which means your doctor may now literally work for the same corporation that's denying your claims.
Right? 10% of American doctors work basically owned by one insurance company, and that's just United Healthcare. Yeah, and over the past 5 years, commercial insurers acquired roughly 40% more physicians than hospitals did, which means your doctor may now literally work for that corporation that is denying your claims. And let's face it, patient care, especially after COVID, I mean, everyone's burnt out. So if an insurance company is giving six-figure salaries to work from home and not have to deal with patients and prior auths, sometimes you just, if you can't beat them, join them. And it's a really sad commentary on where medicine is headed.
And in a lot of these cases, physicians themselves don't even fully understand who it is that's signing their paycheck, because there are layers of corporate ownership that are deliberately opaque. And so the ownership of your hospital, you may not even understand, is also tied to a larger shell that might be the owner of an insurance company.
Yeah. So why is this happening? Because when people hear doctors are leaving private practice, the cultural assumption is they're chasing money, right? We're chasing money. And that's not what's going on. It's actually quite the opposite.
Most of the physicians we know who sold their practice often left medicine, didn't do it to get rich. They did it because they couldn't survive financially in the insurance model. The math just stopped working. Running an independent practice in 2025 is, for most specialties, a losing proposition no matter how hard you work.
Why don't you put it into numbers so we can understand?
Okay, so adjusted for inflation, Medicare physician payment has declined 33% from 2001 to 2025. Meanwhile, medical practice costs like rent, staff malpractice, electronic health record fees, supplies, they have gone up by 59% over that same period.
So down 33% in insurance payments, but costs are up 59%. That's not a squeeze. Like this is just totally unsustainable. It's a losing model.
And the 2025 fee schedule delivered yet another 2.83% cut, effectively a 6.3% cut once you factor in practice inflation. This is the fifth consecutive year of cuts. And because private insurance rates are benchmarked to Medicare, when Medicare rates fall, everyone's rates fall.
Yep. So I want to put this into terms that you don't need a healthcare degree to feel. Imagine you own a pizza shop, right?
I
In
love pizza.
Yeah, you do love pizza. In 2001, a pizza cost you $5 to make and you charged $10 for that pizza. So you make $5 a pizza. Business is decent.
Okay.
Now, fast forward to 2025, that same pizza costs you $8 to make. Cheese got expensive, rent doubled, you had to buy a new oven, staffing went up. But the company that sets your prices, let's call it like Medicare, Pizza Care Insurance, cut what you're allowed to charge down to $6.70.
So I'm losing a dollar 30 on every pizza.
Right. So that pizza now costs $8 to make, and you are only allowed to charge $6.30. Every pizza. And Pizza Care tells you, don't worry, you can make up for that loss in volume. So you can make more pizzas faster, cheaper. You hire a college kid to throw the dough around because you can't afford a real pizza chef. And so this is what we're seeing in the form of people not actually being able to get in to see an MD or long wait lists. Or you used to have 1 hour with your physician and now you have 7 minutes. This is basically the insurance model telling us we have to do more for less. And that's the only way to stay alive.
Meanwhile, Pizza Care, the same company that just cut your rates for the fifth year running, sends you a 47-page form asking you to justify in triplicate why you use mozzarella on the last pizza instead of a cheaper generic cheese product.
Yeah, that's a prior authorization. And if you didn't fill out the form perfectly, they won't pay you for the pizza at all. After you already made it, baked it, boxed it, and handed it to the customer, you don't get paid. This is a reality of physicians. We're not trying to make a sad story and have you guys feel bad for us, but this is American healthcare right now, and it's a crisis.
Yeah, that's pretty much how it works. I think that is pretty much current medicine in 2026.
Yeah. And every year, more pizza shops close. The family owned places with the recipe handed down for generations, those private practices, they're gone. The only shops left are the giant chains, centrally managed, centrally scripted, staffed by people who have never actually made a pizza before.
That's the hospital employed physician seeing 35 patients a day for 7 minutes each.
Yep. And the best of the old pizza chefs, the ones who love the craft and who went into it for the right reasons and did not want to join the chain, they open a tiny cash only pizza shop. They don't take pizza care at all. You pay out of pocket, but you get really good pizza. And that's that concierge model or direct primary care model, because this is the only way to cut out the red tape, cut out the middleman, and actually pay your bills as a physician.
That's pretty much the exodus, right? It's not so much about getting rich. Most concierge physicians make about the same or perhaps even slightly less than what they did in the insurance based practice. What they get back is their time, their judgment, their ability to actually care for a patient for more than 7 minutes. They get to be doctors again. And the cost of that exodus is that we are quietly losing access to real primary care in this country, especially for the chronically ill, the elderly, and anyone in rural areas. The people who need a real physician relationship, they're the ones that are probably losing it the fastest in this kind of brain drain of physicians. And now we have a whole host of, allied health providers that are trying to fill the niche, and the insurance companies and hospitals love that because they cost less, but the quality of care, whether they want to admit it or not, is also a little bit less.
Yeah, what you're referring to are nurse practitioners, physician assistants, which are definitely part of the care team, but not a replacement to see a physician who has done years of residency and years of training. It's just not the same. Did you like the pizza analogy?
I did because I love pizza.
Yeah, I'm kind of hungry. But no, every time you get frustrated with a prior authorization or why you can't get in to see a doctor for 6 months or 1 year, you pay boatloads in insurance premiums, but you're not getting anything. I want you to think of that pizza analogy because it really helps kind of put things in perspective as a whole. All right. So let's move on to segment 5. Who actually pays? Spoiler alert, it's you. So we're going to follow the money. The insurance companies are making $54 billion in profit, which we covered, while delaying and denying care. But who ends up paying for the care that was delayed? Because that care doesn't just disappear, it shows up later, bigger, more expensive, and harder to treat.
So let's walk through this pipeline for what it actually looks like for the typical American. So let's say you're 45. Your doctor wants you to get a colonoscopy early because you have family history. Insurance says you don't qualify yet. Come back at 50. You let it go. You're 52. Your doctor wants a CT scan. Prior auth is denied. You appeal. They approve it 3 months later. The scan shows a small lesion that could have been removed easily 3 months ago. Now it's a little bit bigger. You're 58. Your doctor wants a specific medication to actually control your blood pressure. Insurance says it's not on formulary. Try 3 cheaper drugs first. One gives you a cough, one gives you dizziness. You give up. 2 years of uncontrolled hypertension ensue. Then perhaps you're 64, get an episode of irregular heartbeat called atrial fibrillation. The insurance company is already calculating, we only have to cover this person for 12 more months. You turn 65, you go on to Medicare. And now the American taxpayer, that's everyone listening, picks up the tab for every single problem that was allowed to worsen over the previous 20 plus years.
Yeah, this isn't a metaphor, it's basic arithmetic. Chronic disease now accounts for 93% of Medicare spending. So it's not prevention, that's 93%. And more than 95% of Medicare beneficiaries have at least one chronic condition. So almost half of Medicare beneficiaries have 4 or more chronic conditions. Let that sink in.
These are largely the conditions that were preventable or manageable 20 and 30 years earlier if someone had done the workup, ordered the scan, covered the medication that actually worked, spent an hour carefully thinking about where the patient was headed and was able to actually take the time to communicate that with the patient.
Yeah, instead, those patients arrive at 65 with a full portfolio of expensive disease, and the federal government, funded by all of our taxes, spends the next 2 decades trying to manage the damage. 90% of our nation's $4.9 trillion in annual healthcare expenditure is spent on people with chronic disease and mental health conditions. So almost none of that is prevention, which is really sad. So the grift works like this: insurance companies collect premiums during your healthy years when you don't really need insurance. They deny the care that would keep you healthy when you do get sick or need to see a specialist. Then they hand off the catastrophically sick version of you to Medicare for cleanup and drop off.
They are not in the business of funding prevention because prevention pays off on a 30-year horizon and they will never see you at age 75. Medicare will. The same thing happens also to people who get kind of catastrophically ill, right? If they have no income coming in, then they will fall out of traditional insurance model because they can't pay insurance premiums anymore, and they will fall into Medicaid. And again, the government is picking up the tab because these people, for whatever reason, are sick enough now they can't make income or don't have enough income to pay traditional insurance premiums. And again, the taxpayer is paying. So it's this perfect system of keeping people, keeping these companies' pockets flush with money, and then them never having to actually deal with the consequences of truly sick people.
Yeah, and Medicare pays for it with payroll taxes, right? Which you already paid. And your whole working life, we paid into this Medicare model. So we paid it twice, once for insurance that didn't even help us, right? For the first 65 years of our life, and once for Medicare that now is to pick up the pieces.
Meanwhile, the insurance company that took your money for 40 years puts out a press release about how much they care about you as a whole person and how they care about your mental health, how they're giving you a discounted rate for a gym membership. But really, I don't think they actually care.
It's like those garbage commercials where a healthy person is running with their golden retriever and Blue Cross is like, "We've got your back." Like, no, you don't. You will pull out the rug from every single one of us.
Yes. So let's kind of move on here to the things that they won't cover. We'll give you a partial list of things that would actually help you live longer and healthier that your insurance will almost certainly not cover.
Yeah, and I think a big thing to note, insurance companies are technically required to cover preventative measures, but they are also the ones that define what a preventative measure is. So a lot of the tests we do at MD Longevity Lab are preventative measures. And sometimes our patients ask, why isn't this covered by insurance? And it's exactly what we just described. There's that 30-year horizon of keeping you healthy, and insurance companies don't really care because for them, you're turfed off to Medicare by 65. So, we're going to go over some of the preventative tests, proactive tests that you guys can get that are not covered by insurance, but it's up to you to get them if you want to stay healthy.
And we've talked about a lot of these tests because we do these on our patients. So, number one is a DEXA scan. This tells us your body composition, how much of that visceral or belly fat that a person has, how much lean muscle mass they have, how much bone density they have. This really does predict fractures, frailty, risk of metabolic disease. It's not covered as a preventive care at any meaningful scale.
Yep. The next test is VO2 max testing. So, VO2 max testing, it's where you're on a treadmill or a bike and we put a mask on you and we push your heart. So, it's not the same as a stress test that you would get at a cardiologist office. So, VO2 max is the single strongest predictor of all cause mortality that we have in medicine, period. Better than blood pressure, better than cholesterol, better than BMI or weight. But a VO2 max test right now is not a covered procedure.
Coronary artery calcium score, about $100 test. Tells you whether you have atherosclerosis years before you have any symptoms. Inexplicably not covered by most plans unless you already have risk factors, at which point it's far less useful because we probably could have predicted that you had heart disease if you already have, 15 years of high blood pressure, smoking, high cholesterol, and diabetes. So it would be much more useful in people who don't have a lot of risk factors or are getting it at an age appropriate time.
Why don't you tell us about some of the patients who you've picked up early heart disease even before they're 40 from a coronary calcium score?
Sure. Just saw one this last week. So this happens fairly routinely, where someone will that we see has really says, "I'm pretty healthy. I'm not on any medications. I do have some history in my family of cardiovascular disease, but maybe not until ages 60 and beyond. But they're coming in at age 40." And we do their testing and end up finding out that, oh my gosh, they have a calcium score of 300 or 400, which puts them already at like the 75th percentile for their age group. So this is someone who now at the age of 40, without ever having had any symptoms, actually has coronary heart disease and needs to be more or less maximally treated to prevent the bad outcome, which is actually having a heart attack or even a stroke, because if you have heart disease you likely also have cerebrovascular disease as well.
Yep. So that's a really good point. Another thing that oftentimes isn't covered by your insurance, advanced lipid panels, ApoB, LP little a, which is that one time cardiovascular genetic test, fasting insulin, continuous glucose monitoring for someone who may not have diabetes yet, but doesn't want to get diabetes either. And any of these cost less than one ER visit. but all of them are not covered by insurance.
And I'd say probably the most important one is like, the hour-long conversation with a physician about your actual risks and goals. Insurance really pays for 7 to 15 minutes of FaceTime, and it honestly takes much, much longer than that for us to actually convey the information that a patient may need and for us to know the patient and what's going on in their life and what strategies might actually work for someone based on their own lifestyle. So because an hour of careful thinking might end up preventing the $50,000 of reaction that's going to be necessary 2 years from now when somebody needs multiple stents in their heart after they had a heart attack.
Yeah, it's really crazy. It's like you go to a therapist and it's a 1 hour long visit. That's standard because it would be preposterous to assume that a therapist can get to the bottom of what's going on in 7 minutes. Yet we as physicians are expected to see patients every 7 minutes and take good care of the human body. It's impossible. It's just a recipe for disaster. Patients are upset because, of course, your physician doesn't know you. They're seeing 50 patients a day. So you're just a number to them, and it's not their fault. It's the way the model is set up. So I think we have to start pushing back from insurance companies that we need 1 hour visits. I mean, your visits with patients are 3 hours long, and sometimes they go over, but you have that leeway with them.
Yeah, I mean, I don't think we're going to be able to demand much from insurance. This is going to have to be structural change through government change, to be honest. And the problem is that lobbying between the power brokers here, it's very tight, and we would have to vote people out of office that are not aligned with what actually makes sense for the people. Really, like, there's no business incentive for a company that's going to lose you at age 65 to invest in your health at 45. Like, zero. The longer they delay, the more money they end up saving. This is really the fundamental misalignment at the heart of American healthcare. The entity paying for your healthcare in the short term is not the same entity that'll pay for it in the long term. So preventive medicine, which only works on long time scales, is economically worthless to them.
Yeah, but it's priceless to you and us.
So let's do the prevention math because I don't think people probably appreciate this until they see it. A single heart attack in the United States, all in ambulance, ER, cardiac cath lab, stents, an ICU stay, rehab, 6 months of follow up, that averages anywhere between $50,000 to $100,000. A cabbage, right? So coronary artery bypass graft, where they got to cut open your chest and graft one of your veins into your heart to replace a bad artery, that pushes you well past 150, $200,000. Type 2 diabetes adds roughly 10,000 a year in direct medical costs for the rest of your life. Over 20 years, you're into the mid six figures easy. And that's before like insulin, monitors, kidney complications, eye complications.
Yeah, a stroke can run $150,000 in the first year alone. Plus, long term disability care, which we didn't include, that can exceed $1 million over the course of a decade. A hip fracture in an elderly patient with osteoporosis runs about $40,000 for that surgery to repair, plus rehab, plus often a nursing home stay. And 20% of people over the age of 65 who fracture a hip die within that year.
So compare that to what it costs to actually prevent these things, right? A DEXA scan, 150 bucks. VO2 max, $200. Coronary calcium score, $100. Comprehensive biomarker panel, a few $100. An hour with a physician who can actually sit down, synthesize it all, maybe $500 to $1,000. So for $1,000 to $3,000 a year, you can get a genuinely comprehensive picture of where your body's headed, what to do about it, intervene 10, 20, 30 years before any sort of catastrophe happens.
And your insurance won't cover any of it. talked about average premiums being $26,000 a year. And most people aren't even using that, right? And like you said, the testing that we do, 1,500 bucks covers so much more than a primary care visit. And compare that to the 26,000 people are spending annually.
Or 150,000 after you've already had the heart attack. And the problem with that after having the heart attack is that you have now lost some function, right? You have lost quality of life that the insurance company can't cover. All they're doing is helping you get through the acute event.
Oh, yeah, they'll cover that. They'll cover your heart attack, or Medicare will cover your heart attack, one of the two, but they're not going to cover the preventative measures that we need 20, 30, 40 years in advance,
That's right. And statistically, most likely it's Medicare that's covering it, which means it's the taxpayer,
which is us.
which is us. So, what can we actually do?
All right. So we've laid out the problem for you guys. So let's give you guys something actionable because nothing drains hope faster than 45 minutes of a negative diagnosis with no treatment plans. So, 5 things starting this month, none of which require an active Congress because I am not waiting for it. Like, don't even get me started on the state of politics, but it is gridlock. So, we cannot wait and hold our breath and wait for our politicians to make positive change for us.
Okay, so first, and this is most important, I think stop waiting for your insurance company to care about your prevention. They don't. They're not going to. If your plan is, I'll do the thing when it's covered, your actual plan is to get sick first and then be partially reimbursed for the cleanup. Your insurance company is not a partner in your longevity, it's a catastrophic backstop for truly bad outcomes. Treat it accordingly.
Second, build a prevention budget and treat it like any other non negotiable line item. The average American spends $5,000 a year on a car they will drive for 10 years. You get one body your whole life. One, we don't get to trade it in for a new one. So spending $1,000 to $3,000 a year on testing for your body and a real physician relationship, it's not a luxury, it's basic maintenance. So most people wouldn't dream of skipping an oil change, but will happily go a full decade without knowing their ApoB, without knowing what their VO2 max is, or whether they have plaque in their arteries. So that calculus is completely backwards. We have to start prioritizing our health.
Third, use your HSA or FSA aggressively. Most preventive testing, including DEXA scans, VO2, calcium scores, they can be paid with pre-tax dollars. Depending on your bracket, that's a 20 to 40% discount on everything you do for yourself. The insurance companies hate this because it's one of the few mechanisms where you can invest in yourself with money that they can't really block, deny, or slow walk through prior authorization process.
Fourth, appeal every denial, every single one. Because, like we mentioned, 80% of appeal denials are overturned. The insurance company is wrong 4 out of 5 times. They are statistically betting that you are going to give up and not appeal. Don't give up. It's annoying. It takes an afternoon of sitting on hold or banging your head against the wall with lots of expletives. The last time I had to sit on hold, but the expected value of that afternoon is enormous. You will end up getting the care that you need. Every successful appeal also makes the deny first business model marginally less profitable for them, which is a public service that you're doing for everyone.
Fifth, vote with your feet on primary care. If your doctor is giving you 7 minutes and a follow up in 6 months, that's just not primary care. That's administrative coverage dressed up to look like medicine. Find a practice that actually gives you physician time, like direct primary care, even concierge or a longevity practice, even a good functional medicine practice. Any model where you get real time with a real physician who can actually think about your case. Yes, it will cost money. Your insurance won't necessarily reimburse. It will also, over the next 30 years, save you orders of magnitude more than it actually costs you, and it'll save you in quality of life more than anything.
Yeah, you're not going to out argue the insurance company on the phone. You're not going to reform the system from your couch, but you can route around it quietly for yourself, for your family, your loved ones, starting this month. All right. So let's close with the genuinely uncomfortable part of all this.
The American health insurance industry is not going to reform itself. It honestly, it has no reason to. It makes billions of dollars, right? 54 billion a year doing exactly what it is doing. Every time there's a PR disaster, and there have been many, right? Like the who's a Luigi Mangione case recently with United Healthcare. They basically rebrand, they reshuffle, they change some leadership role, but it's basically business as usual. The regulatory infrastructure that was supposed to keep them honest has been systematically outgunned by lobbying, corporate consolidation, and the sheer complexity of a system they benefit by keeping opaque. And the political will to fix really, it comes and goes with election cycles, while the insurance companies operate on a 50-year time horizon. That means realistically, the reform is not coming in time for you or for me or your parents or possibly even your kids. So the question isn't when will the system fix itself? The question is, what am I going to do for me and the people I care for while the system continues to function exactly as it is?
Yeah. And the answer is hard, it's expensive, it's unfair. Prevention has become a line item you'll increasingly have to fund yourself because the people collecting your premiums have no economic interest in keeping you healthy. And until that changes, it's going to keep going in that direction.
I wish it wasn't true. I mean, I wish I could tell you that your insurance company is secretly rooting for you. I don't really think they are. They're rooting for you to hang on quietly and without making a fuss until you turn 65 and become the government's problem.
Yep. And then the government, funded by you and your children, will pay for the heart attack, the stroke, the stent, the nursing home stay, the dementia care, the full downstream cost of decades of prevention that nobody paid for because no one was incentivized to pay for it.
Unless you had the incentive, right? Unless you did the DEXA scan at 42, unless you got the calcium score at 45, unless you found a physician at 50 who actually sat with you for an hour or two and thought seriously about where your body was going. This isn't a pitch for our practice. This is just the mechanics of the system that we live in. The statin in your medicine cabinet is evidence-based medicine. The prevention budget on your spreadsheet is evidence-based citizenship.
Because the people who were supposed to care about your prevention have quietly decided not to. So that leaves you and us playing the long game.
Nobody else is going to play it for you.
Yeah. So we hope you guys learned a lot about, I guess, the barriers that we're dealing with in practicing medicine. And this is just the current state of affairs that we live in. We wish healthcare was better. So we hope you guys found this useful.
And hopefully that it motivates you to be a little bit more active, treat your body a little bit kinder because it needs that. And I don't think that the insurance companies are going to do anything to make it easier for you.
Yep. So until next time, guys, keep playing the long game.
Take care. Thank you for playing the long game with MD Longevity Lab. You can visit us at www.mdlongevitylab.com to learn more about how we can support you on your journey. Stay connected with us on social media at MD Longevity Lab for tips, updates, and behind-the-scenes insights. If you enjoyed today's episode, we'd love it if you subscribed, left us a rating, or shared it with someone you know who's also playing the long game. Thanks for listening. We'll see you next time.